women say, I don't know what it is, but I don't feel the same. It's just a wonderful thing. It has changed my life, and I have now pretty much fully converted my practice to just hormones and weight loss. It's truly become a passion of mine because of how it's made me feel and how my patients are responding to it. Is this what teenage boys feel like all day? Because I just want to like lift heavy weights and have sex. That's
Welcome to the Nurse Boss Shift. It's your girl, Dr. Kiiyonna Jones.
And I'm Christal P, the beauty NP.
Okay, so today's topic, we are talking about something that's extremely personal, but like life-changing for Christal and I, because as you guys know, what you don't know, you are going to learn today that both of us are actively practicing in our clinics. And in addition to mentoring and coaching other nurses in entrepreneurship, plus the podcast, we be doing a lot, okay? We thought it would be important to come on and talk to you guys about something that's more personal, but y'all need to know it because most of our listeners fall within the 35 plus range, right? And so that topic is BHRT, also known as bioidentical hormone replacement therapy. Now, let me say this. This is not a come let us be your providers for it, but you can. But this is really about what we have what we have realized and experienced as a result of hormone therapy, okay? Bioidentical to be more precise. And so, Christal, it's funny because Christal, you and I both found out about it at the same time. We were both at a conference. And then this lady, Dr. Kimberly Evans, who was out of Sugar Land, Texas, we'll never forget her, came up. They gave her a short speaking window at the AmSpa conference, by the way. But I remember sitting in that room feeling heard. Like I felt like somebody gets it. From there, you and I, amongst probably the whole room of women, bombarded her like with questions and like just kind of like
mentor us.
Yeah.
Helping.
And she was not just talking about like, oh yeah, get your hormones balanced because you feel better. She was talking about sex and she was talking about low libido. And I was like, just shocked that it was just so blatant with it. But also I was seeing the women in the room and everybody was just like, oh my gosh, this is definitely what I am going through. And so the reason why we decided to talk about this today, you guys, because I know that there's a lot of women out here suffering. I know I definitely was. And I'm going to be transparent about my experience. And I know Christal will as well, because we want to help you guys. Most people experience it over 40, but even some as young as 35 and even younger, we've heard about situations where they were imbalanced hormonally based on their symptoms who have really been helped as a result of it. Like I say, Christal and I. So Christal, tell about your experience. So I know we were in the room together, but how did you feel when you heard Dr. talking about it?
So I always tell people, really only went to her speech because she was the only Black person on the panel. So yeah, we're like, let's see what this lady has to say. I don't even remember what it was titled, but I remember this doesn't really have anything to do with me because this is hormones.
Right.
And that's older women. And she starts talking about these things, like you said, and I'm just like, wow, a lot of those are me. So at the time, I think I was 38 at the time. I had 2 babies back to back. They're like 19 months apart. And I just remember feeling women say, I don't know what it is, but I don't feel the same. So just very like fatigue. I remember, oh my God, I remember every Sunday, like, do not bother me. I'm in the bed, like just exhausted from the week, low motivation, trying to start this practice. And this is when I was deciding to move into my own space. I was just low motivation, just low energy, all the things. So she starts talking about it. And I was really interested, like, okay, some of this is me, but my patients would probably really benefit from this. So started looking into it more so for how my patients could benefit from it. And then as a part of the training, of course, they want you to get your hormones replaced. And we always talk about this too. When we went to the training and you're seeing all the conferences and you're seeing all the people who've been doing getting their hormones replaced for years, they all looked really good. Like their skin all looked good. They all were fit, muscular. It's like, okay, must be something to this. So as a part of it, we got our hormones replaced with pellets at the time. And it was like, wow. Like another thing my patients say is like somebody turned on the light bulbs. All of a sudden I was just more motivated, more even like confident, just walking taller, energy, brain fog was going. I remember times on the podcast, I couldn't even remember words to say. And I didn't know what I was just like, like a lot of you know, I was trying to work on myself with but I just, just a lot. So got my hormones replaced. And I tell this too, I was doing semaglutide at the time. They kept taking it away from California. So I had lost initially 40 pounds. And at the same time, when they weren't shipping it anymore to California is when I got my hormones replaced. So I got off semaglutide, but ended up still losing another, 15 pounds since then and have kept it off. Not to mention the other benefits that it has towards it, which is the brain protection, heart protection, and bone protection. So it's just a wonderful thing. It has changed my life. And I have now pretty much fully converted my practice to just hormones and weight loss. I do a little bit other things, but it's truly become a passion of mine because of how it's made me feel and how my patients are responding to it and how they feel. And I have and the reason I was like, we should do an episode on this because on YouTube, I do a lot of nurse content and I also do some hormone therapy. And it's so funny how nurses will find me because they're looking for help with entrepreneurship. And then they mosey on, they're like, wait a minute, what's she talking about? And then they see all those things are them too. So I just thought this could really help women, especially if you're struggling. There's so many, the research shows that women will go to like 7-8 doctors trying to figure out, and they're getting put on this pill and that pill and this pill and that pill, when really it's because the hormones are imbalanced. So if you are someone who's like overwhelmed, struggling, just mentally not there, it could definitely be your hormones.
Well, let's talk about something. The average age of nurses is about 43.6 years old. And the females are about 43.6 years, right? We're most of the profession. This is not just for women. This is also for men as well. And men have a lot of benefits. What I find that I treat couples, because I tell the woman, I say, most of women come to me, right? That we tend to attract who we are. But then I say, listen, you're going to want to get your husband on this because the way your libido shoots up, you're going to leave him in the dust, right? So you want to be equal. And so I tend to do men as well. It helps men a lot. Their endurance, their muscle increase, because you start having muscle wasting after when your hormones get to a certain low level as men. As women, if our testosterone gets below 30, the research says we can't even build muscle. So if you're like, oh my gosh, I've gained so much weight, like I don't know what's happening, it's most likely your hormones. And what I like about bioidentical hormonal therapy is you really are getting to the root of the problem versus like, throwing some SSRIs at you or some other type of antidepressant, treating the surface level issue versus getting deeper to what the problem is. Now, my question to you is, some people are going to listen to this and be like, but I thought that causes cancer. Because I know that's what we thought. We were like, wait a minute, we got to do some more research, because I know in nursing school, I will never forget sitting in women's health class in nursing school, and they were like, what we want you to know is with hormones, think cancer. And I have never, and I will never, and I talk about this all the time. I think I talked about it on my Instagram page, my mom. And I remember her at the time, this was in 2006, and she was going through it, and she was like, I'm thinking about hormones, which I was like, no, cancer. And it's so funny because now I'm like, Mom, you need to get pelleted. She was like, but I thought you told me. I was like, that was the end. Right. What I know there. She's 65 years old, you guys. I have my own mom pelleted, and she loves it. So what would you say about that?
So as far as cancer, hormone therapy does not cause cancer. There was a study done it was done years ago, but it came out in 2001.
The Women's Health Initiative study came out I think it was 2002 or somewhere up in there, a long time ago. Yeah.
Yes, a long time ago. And what it basically did is front page of the news, hormone therapy causes cancer. And what ended up happening is doctors got scared, public got scared, and they ended up taking everybody off their hormone therapy replacement. So I'll just say, since they have actually studied what happened to women since they took them off of their hormone therapy, and it was actually worse than what the study was saying. But the study was flawed, and they have since come out and refuted what they said, took it back. But the impact that the study made on people was so major that now it is, we are trying like hell to turn that around.
Yeah.
But it basically, the study, they were testing people who were using estrogen. There's a certain type of estrogen that they used to extract from horse urine.
Yeah.
So that was the estrogen they were using. They were also, a lot of the people who were tested or in the study were already of older age. So they were in their 60s and 70s. So they already had a higher risk of breast cancer at the time. So that was one thing that was wrong with the study. Also, when we give hormones, we have to do it correctly. So for instance, if you get estrogen and you have a uterus, we have to give you progesterone because estrogen by itself can cause cancers to grow. So you have to do it correctly, but on its own, hormone therapy doesn't cause cancer, especially the bioidentical hormones that we're giving now. Before they were synthetic, now they are, this word bioidentical, meaning they're closely related. The chemical structure is closely related to what we already have and produce, and not ones that are coming from animal products. So it does not cause cancer. That was a big scare. But they did notice that women had a higher number of osteoporosis after they were taking off their hormone therapy, UTIs, and we all know the death rate of those older people who break bones and break hips. It doesn't look good after that. Hormone therapy, as I said, it protects the bones, and also it decreases the number of UTIs that people are getting. We also know that estrogen, if you have a specific type of breast cancer that is estrogen receptive, that giving you estrogen can make the cancer grow faster. But when you have an astute practitioner, they're going to make sure you're getting your mammograms. And it's actually better if we catch it faster than it growing and us not knowing. So it's actually saving lives in that case. But no, it does not cause cancer. And unfortunately, women are gaslit in women's health every day because we know we are suffering, and doctors or providers are saying gamut of reasons why doctors can't put patients on hormone therapy. It just baffles me, like the excuses that they say. But practitioners are scared. They don't know how to prescribe. So they're just using any reason to tell you that you're fine and you'll be okay.
And all but one of the researchers over the Women's Health Initiative study recanted their position, you guys. And there were like 15, there was a lot. And that's something that, I don't know if you guys know this, but in the world of research, you don't recant, right? Because you should have done all the things on the front end so that you wouldn't have to. And for that to happen is extremely powerful. And when that happened, not when they recanted, but when this study came out, there was a huge increase in antidepressants prescribed to women. I mean, it was really a bad experience for women who were of perimenopausal or menopausal age range during that time because they had literally no support. There was a few doctors who were like, we still gonna do it, but very few. Everybody was taking them off. And so the thing is, they were using the wrong estrogen. It was the estrogen that they were saying was linked to an uptick in breast cancer. They were using the wrong estrogen. It wasn't the one that looked a lot like what we already create. That was one problem. And then the next huge issue with that was that women were not given the progesterone that they weren't given was not preventing the overgrowth that happens. You guys know endometriosis. If you don't have the progesterone on, then that lining is not being shed adequately. So that could build up and they end up becoming cancerous cells in the uterus as well. So you got the breast cancer and then also the increased risk for uterine cancer. So there was a lot of flaws in that study. And since then, the women who were not receiving estrogen and progesterone together, the wrong kind, they still left that arm of the study open. So now 20-something years later, they're still doing well. They're still thriving. All-cause mortality is down for them. The incidence of osteoporosis, like Christal said, is down. Like there's just, now they see so many benefits because of them being on hormone therapy. So my experience, I was like, finally I decided. Christal had already jumped on board. And I was just kind of like, ugh. By the time we left, I was excited. And then I was just like, Mark, let me do this. But I wanted to offer it. If it's really what it says, I do want to offer it to my patients. So I'm like, let me try it. And so Christal actually inserted my treatment. And it was life-changing for me, to be honest. It was like, I did not realize how bad off I was until I got the pellets. And I was like, damn, like my poor husband, right? And on so many levels, I didn't realize how bad my libido was, but it felt kind of, it's such a gradual, the symptoms don't just, bam, you wake up and you're like, I'm tired, I'm this, I'm that. And it's like just gradual over time. And so for me, it kind of felt normal. Like, and then don't forget, if you go to the doctor and tell them, I'm just not feeling myself, they're going to tell you, okay, like you're in your 40s, this is about right. And so, but when I got pelleted, it was like the veil was lifted. It was like, oh shoot, like I have really been compromised out here. Like I feel so much better and like just everything. Like I'm gonna keep talking about libido because that's one of the first symptoms that you feel when you are pelleted. And I was just like, wow, this is a huge difference. So yeah, exactly. Woo.
I asked my trainer, I was like, is this what teenage boys feel like all day? Because I just want to like lift heavy weights and have sex. That's
Attention, aspiring entrepreneurs in the healthcare industry. Have you ever dreamt of starting your own successful IV hydration business? Well, your dream is about to become a reality. Imagine a business where you can make a difference in people's lives while building a thriving venture. We're excited to invite you to a free webinar that will unlock the secrets to launching a successful IV hydration business. Join us for an exclusive event where industry experts will share invaluable insight on the essential steps to launch your IV hydration business, building a six-figure business from scratch, navigating the challenges in the healthcare entrepreneurship journey. But that's not all. Attendees of the webinar will get a sneak peek into our comprehensive IV hydration on-demand course. Discover how this course has empowered others just like you to turn their passion into profit. Picture this: lifetime access to in-depth video trainings, business strategies, SOPs, and exclusive bonuses that can catapult your success.
Register now for our free webinar at https://apply.trueusavvy. That's truusavvy.com/training. Don't miss this opportunity to kickstart your journey to a rewarding and lucrative IV hydration business.
As long as you keep your pellets up, like for me, I prefer to get mine every 3 months. I like to run a little bit on the higher side. And what I like is we treat how you feel. So it's more functional than it is like Western medicine. So it's like, how are your symptoms? How are you sleeping? By the way, those of you who are just like not able to sleep and all those hot flashes and all, it's your hormones.
There's over 35 symptoms that they've attributed to perimenopause and menopause. Another thing I don't even think a lot of us know when we're in menopause, but basically it's just a decline in your hormones. So as far as the testosterone, definitely in the mid 30s, that can start to decline. Your estrogen starts declining as your periods start acting funky. But I just wanted to list some symptoms so you guys can know, because a lot of times we have things that are going on and we don't even know that they're part of our hormones declining. So some include, let's see, of course, your hot flashes or night sweats. I had really bad night sweats and I didn't even know night sweats was a thing. I'm freezing, so that's a part of your thyroid, right? I'm freezing during the day, but I'm hot in the middle of the night. So period changes, of course, mood changes. So irritability can definitely be a part of hormones declining. Vaginal dryness, vaginal pain, low libido, those kind of go together. That can be a symptom of it. Definitely sleep problems. So if you're waking up during the middle of the night because you have to pee a lot, actually peeing a lot during the middle of the night can be hormonal too. Also hot flashes during the middle of the night. And then if you find yourself, you can't fall asleep, so you're having anxious racing thoughts, thinking of the next day, that can be hormonal. Easy supplement that you can take at night can help with that. Weight changes. So I have a lot of women who come to me between this age, and a lot of women too. And I always talk about me still working per diem at the hospital. I get to talk to so many more women because when I see the women that are in my practice, I kind of excuse. So even my weight loss patients, because I'm working with them closely, I don't see all of the all of the side effects that you can have with these weight loss meds. When prescribers just prescribe medicine, they're out the door and we don't talk to them. But with hormone therapy, the same, you're able to, with your provider, figure out what symptoms you're having, and then that will tell us what hormones that we need to replace within you. Also, what are some other ones? So the weight gain, I was saying, if you are doing all the things, you are in early 40s on up, you're working out, you're eating strictly, but the weight won't come off, it's mostly hormonal. Brain fog, we talked about that one, not being able to find the words, low libido. Palpitations, you talked about that.
Oh, that palpitations was a big one for me.
Yep, palpitations.
You think you're going crazy. Like, am I having a heart attack? It's the hormones, you guys. Yes, palpitations.
Ringing ears, dry skin. So I always tell my clients, think of estrogen as a lubricator. So dry vagina, dry bones, dry eyes, dry skin, that is all a part of estrogen. So if you're having those symptoms, that is a part of your hormone changes. Also, they just had a big study. This is big in women's health, but just joint pain is associated to declining hormones. So if you wake up, you have that frozen shoulder, especially after pregnancy. I had to get out the bed. My feet felt like they were on fire. So I made it to the bathroom, and then that kind of goes away. But all those stiff joints is a part of declining hormones.
I heard someone say this and I can't unhear it. The woman's body is the most understudied, not her uterus. Her uterus is studied because that brings forth life. But everything else around her is so understudied by medicine. And a lot of the people we follow, Christal, who is in this space, are getting their research from Europe and other countries because in the US, they just don't study us. So if it's not about bringing babies in the world, they don't really care about us. When I heard that, the person who I was listening to, they said, it's like, even from taking medication, the studies were predominantly male because women go through so many changes over a 28-day cycle. Hormones all over the place during our menstruation, like all of that. So in order to keep their sample consistent, they would only study white males. And so just think about women and then women of color in it. So most of these medications that we use were not even for us. And hormones really, if we're talking about our libido, there are some, and we can talk about that real quick, Christal, because there are some medications that are out here
that just came out
to help us with libido. But when you talk to what's her name? The one for the Addie, she was saying she had to fight so hard to get a FDA approved for this medication for women who are struggling with low libido and to treat hyposexual activity disorder. I think that's what it's called. Hyposexual desire, something, whatever it's called. But yeah, so she they didn't care. But when they accidentally stumbled on Viagra, it was over, right? But we have to fight so very hard. And it's because we're just not studied. They don't care about, I don't want to say that's real general, but I believe it. It's not enough.
And I just wanted to piggyback off of the studies on men too. And the same goes for our ranges, right? So please, this is the soapbox of my social media. And especially for you nurses listening, if you went to the doctor and they say you are fine, you're within range, and you don't feel that you are fine, please know that you are not. So especially the range for testosterone is from a teenage boy. The ranges for testosterone with women aren't even somewhere where you would even begin to feel the effects of it. So a lot of times testosterone is always thought of as a male hormone. Men have estrogen as well. Estrogen is thought of as a woman's hormone. But please, I just want to make that announcement that if you went to your doctor or you went and they ran a few tests, most likely they don't even know what tests to run, because I say this as well. If they run the tests that are really needed to balance your hormones or optimize your hormones, they don't know how to treat it. So if something comes up red, they don't know how to treat it. They have to address it. So how do they get around that? They don't test it. So they may test your TSH and say your thyroid is fine, but we know as hormone specialists that the ranges can be off, and there's a difference between being within range and being optimized. So that's what we're talking about. So,
and the active form, you got to look for the T3 to know really, you can pump out all the thyroid stimulating hormones, whatever, but is it going where it's supposed to go and doing what it's supposed to do? We don't know. Or is it enough of is it converted to the active form? They're not even looking for that. They're like, okay, your thyroid is good.
Yep, they're just fine. And actually your thyroid has to be really damaged before it starts showing on blood work. So I just want to say that if you said, I've been down that road, I had them checked, my friends talked about it and they said I was fine, please find someone who's a specialist and does this.
A functional medicine or some kind of hormone specialist, you guys, is where you want to look. Most likely your doctor is not, they've been told not to, especially even endocrinologists. They are like, they're not fans of this, you guys. So make sure you go see like a functional medicine person or even a specialist to a hormone specialist to take a look at your labs. They're going to get way more detailed in your lab work. And you're right, Christal. So the reference range is another thing we have to realize is think about a bell curve. And so you got 2-year-old to 99-year-old. And then wherever you fall in the middle is where the reference range is. Does that make sense? If you take that and you look at all the women ages 40 to 45, it's going to give you a different picture. And you look at the ones who feel good versus the ones who don't and look at their hormones. That's going to give you a totally different picture than you're looking from 2 to 99. And that's pretty much what they do with those reference ranges. That's why we don't really look at those. And we really look at like, how do you feel? So even when I first got pelleted, I was like, I think I got pelleted the second time. It's been a year and a half I've been doing it, but I got pelleted the second time. And I remember I was like, you got to put me up. Like, I'm not feeling the same way I was after that. And so now we know I run kind of high compared to everybody else, but I feel good. And it's about how you feel, right? I have less symptoms. Working out, like I'm just feeling like my muscles coming in, and it's just a whole different experience. So I think we just wanted to kind of pour into you guys. And Christal, I want to talk about the two, like Addyi. And
So there's two for the libido. There's two supplements that we have. One is called Addyi, so it's ADDYI, also known as the pink pill. That one is a pill that you take every night. It takes about 8 weeks to work. But women say, they start to, our sex doesn't start to feel like a chore, or they're more enjoyable and agreeable to it. So Addyi works on those dopamine receptors or serotonin. But it's kind of just a gentle segue into increasing the libido. And then there is Vyleesi. Vyleesi is an injection. So Vyleesi is more for date night, or you're out for the weekend, or you just know that the act is going to happen that night. That's something that you would take like 45 minutes to an hour. They say 45 minutes, but it took mine about like an hour and a half to kick in. That one just dumps that dopamine. But yeah, those are two options. There's also a compounded version of Vyleesi that you can get, like a peptide. Again, going to like a hormone specialist, you will find out about that. And then just testosterone alone will increase your libido very well. So
the big
there's a lot
from this session, y'all. You're not crazy.
No,
feel different if you know, like, and I promise you, after this, those who are listening and who this applies to, you're gonna be like, hey, you'll start noticing the things that you just kind of attributed to your just normal getting old self. To let you now gonna hear what we're saying, and then go seek out a hormone specialist in your area. Feel better, okay? Like, we on a mission, y'all. You guys are all entrepreneurs or aspiring entrepreneurs if you're listening to this podcast. And the best thing you can do for your business is to take care of yourself.
Mm-hmm. And
yourself. Put you first and go get your labs checked out from a functional medicine provider. Most likely it may be a cash business, because most of them are not, that your insurance will not pay for. They don't care if you're having great sexual pleasures. They don't care if you are anything. They just want you to be okay, like healthy wise, but they don't care about that. Yeah. So I know I was saying that you need to prioritize your self-care, and especially if you plan on being an entrepreneur, because and this is extremely important, you guys, because you have to be at peak condition to handle the stress of it, but then also to be able to think outside of the box. And I think that's often missed because we're just thinking that we're going to start this business and like everything's going to work out. It's not. If you plan to ascend to higher heights, it has to break down. Everything has to break down as you know it, so that it can be rebuilt. And so you have to also break down. So prepare yourself so that you are the strongest version of you, if you're especially over the age of 35 or early 40s, really. But I know some people, I hate to leave out that weird 35 to 40 part, because like you said, you starting when you were 38. So it is that part in there that you may need to start at that time.
Yes, especially with me, because they said when you have kids back to back later in life, which I did, then that drastically affects your hormones. What a difference.
Well, I think this this was a good episode, you guys. We try to do a little bit different, but we felt that it was important to talk about this because of how transformational it has been in both of our lives. It's not just me. It's not just Chris. We both have the same experience about the value of hormone replacement therapy, especially at this age. So if you guys have other questions or you want us to talk about this more, we could dive a little bit deeper, go into all the other different vitamins like vitamin D that people don't talk about enough that you really need, and the other vitamins that we really
protein. We could turn this into a wellness.
Right, wellness. We got a lot to tell you guys.
We got to take care of ourselves. Yeah,
we have to take care of ourselves so that we could show up the best versions for our business. So until next time, you guys, don't gatekeep. Make sure you share this with other nurse entrepreneurs, other nurses, other entrepreneurs, period, who are interested in learning some strategies, tips to grow or start their businesses. This platform is for you. We are trying to show up to represent us. And somebody we had on the previous podcast at the end, once we were off air, said, you guys got the #1 nurse podcast, and I'm feeling that. I was like, right, dealing with that. Like, yes, right. #1, too. #1 nurse podcast on all these podcast stations. Yes. It is us.
Yes.
So make sure you guys share it, comment, and then just also continue to exchange dialogue with us just to make sure that we are showing up for you and your needs. You guys, that's important for you to let us know. Until next time, you guys, see you soon. Bye.